maybe also worthwhile to mention, there was also agreement on goals, very specific quantitative goals, and I will just only mention them in passing. One was the notion of universal access to reproductive health, to make sure that every person who wants to use these services has access to them. Second was the reduction of maternal and infant mortality and child mortality. And the third concrete goal was universal education, but especially education for girls. And of course, luckily so, these objectives and targets, they were then reaffirmed and reinforced in other conferences. So the Women's Conference in Beijing came the year after, and they have now also been incorporated in the Millennium Development Goals, the goals that sort of guide today overall development work and give sort of an overall chapeau for development assistance. So that's a little bit of a background, and some of you, probably many of you may know that already, but I think at the 15 years of Cairo, it's important to remind ourselves that we have this international agreement. It's still as relevant today as it was then. So let me then turn to highlight some of the things that we have all been working on and some of the progress that has been achieved since then. And also I'll identify some issues that require our attention today. I'll talk about sort of three areas. One is girls' education. The second one is sexual and reproductive health, and then a little bit about gender-based violence. And time may not allow to go very deep in any of these, but we can come back in the discussion. First on girls' education. So the good news is, there is good news also, that in the past 15 years there has really been a push for universal education for all, and specifically to help get girls into educational programs. And progress really has been made. Worldwide, there are more children in primary school than ever before, but including also girls. So that's primary level is making really good progress. And for example, in the developing regions as a whole, the number of girls enrolled for every 100 boys rose from 91 back in 1999, to 95, so almost in 2007. So it's going up slowly but surely, and it's almost getting there to be equal number of boys and girls in primary school. But of course, it also varies very much by country, and especially if we look at secondary level. So in this slide, you see it's the ratio of girls to boys enrolled in secondary school, and just examples of some countries, how much difference between 1990, that's the blue things at the bottom, and then 2005, the orange on top. So you can see on the far left is the example of Chad, and there we see that less than 4 girls attended high school for every 10 boys in 2005. So they have made little progress since 1990, basically, very much still lagging behind. But luckily, there are some good performers. So that you can see in the middle, Bangladesh, in the center, where during the past 15 years, girls actually have gained equality with boys at the high school level. So they moved, the equal number of girls and boys is the one, and they are there. Now, the benefits of education, of course, it's a good thing in itself, but it also has an impact on many other things that determine the lives of people, and especially girls. Better educated girls are less at risk of death and disease. They generally have fewer and healthier children, and they also end up being better off in terms of income and earning later on in life. And we have very clear evidence of this from studies. For example, there is a World Bank study which showed that when women gain 4 years more of education, they can see that fertility, or the number of children per woman, drops by roughly 1 birth. So education means fewer and healthier children. There was also a study in Brazil that found that literate women in general, irrespective of the number of years of education, if you were literate, you had half as many children as women who were illiterate. So literacy in itself is an important, determinant. And as I said, educated mothers also have better educated and healthier children. So it's an intergenerational transmission. Once a girl gets educated, it's almost, sort of for sure that the next generation also will be better off. A single year of secondary education correlates with 15 to 25% increase in women's wages later in life. So also it's not only good for education itself, for health, for family size, it is really also an improvement in the economic situation of girls and women. So our challenge there is really to make sure that it's not taken for granted. At a time such as this, where there are lots of competing priorities and economic troubles here and everywhere, that we continue to make the case for investing in education and education of girls. So I think that's one of the messages from here. And equally so, we must continue to push for universal access to reproductive health. So I will now turn to looking at access to reproductive health and sexual health. Here, too, we can see progress, and time obviously doesn't permit to touch on everything. But for example, today, there are more births that are attended by skilled health personnel. That is, the actual delivery is being taken care of by somebody who is properly trained. There has been progress on this. For example, in East Asia, nearly every birth is now assisted by skilled health workers, and substantial improvement gains have also been registered in other regions, namely in Latin America and North Africa. So, there is good change in the right direction. Now, in the area of family planning, we also see today that more women and couples are choosing to actually plan their families. They actually space the pregnancies, and they themselves are able to determine the number of children they are having. More women and men are using actually modern contraception, and birth rates also have declined in all regions. Also, another area in reproductive health, this is maternal health outcomes in the negative way, but we have seen progress, and this is do with ending obstetric fistula. This is a childbirth injury that was eliminated actually in the wealthy countries a century ago. So 100 years ago, there were already, improvements in this area, but it continues to afflict millions of poor women in poor countries. This is a condition that leaves, young girls and young mothers incontinent. They're basically leaking urine and feces, and therefore not only are they in pain physically, but they become socially outcast. They're abandoned by their family